Hi, I'm Marjorie Stanton from Best South Behavioral Health. I'm the Intensive Mental Health Treatment and Rehabilitation Services Vice President. Here at Best South, we started our Mobile Mental Health Services program in April of 2017. We began that program due to Medicaid changing its managed care benefit program, the Licensed Behavioral Health Practitioner. Once our agency was approved for CCBHC services, we were able to increase that mobile mental health program. In our mobile mental health services program, we have an entire team that works with these individuals off-site and primarily in their home. This includes counselors, social workers, RNs, and prescribers. Clients often have a lapse in their care due to a barrier. What those barriers often look like for us is clients who have mental health symptoms that have increased, also sometimes physical health barriers to getting to our clinics at the sites. For example, we have clients who have had increased in depression symptoms, so the idea of even taking a shower, leaving their home, or utilizing transportation just becomes overwhelming, and therefore they don't attend their traditional clinic services. Another example of when we have clients that really benefit from mobile mental health services is when they have a physical ailment. So either they're working through some end-of-life concerns where they have the VNA or hospice in their home, or they have to have extensive surgery, which will make them bedridden for a period of months. In both of those examples, we are able to offer those services in the comfort of their home so they don't have a lapse in medication management, health monitoring from our nursing staff, and our counselors who then are really able to offer coping strategies and assist in that symptom reduction. Another big important part of the mobile mental health program, which has been increased since we've had CCBHC services, is my RN staff. They work exceptionally well with the client's primary care provider and to offer pharmacy services. Oftentimes when clients have these barriers to our clinics, they also have those barriers to getting to their physical health appointments and obtaining the medications that they need. My nurses will work to get VNA services into the home, work with their primary care provider so that we can draw any important labs that are necessary for them to continue to get the pharmacology medications that they need in order to monitor diabetes or their cardiovascular disease. We also work with local pharmacies to have delivery services of their medications at the home. So we're really trying to break all of the reasons a client would have a lapse in their physical health or mental health services by being at their home and branching that. A typical day for our staff would be that they start at the office, they kind of regroup, they get a sense of making sure they know where their appointments are going to take place. They obtain the technology that we use in the homes, which is smartphones with Wi-Fi built in and Surface Pro so that we can conduct all services at the home. They go out and they're meeting with clients, meeting with families, and they're offering those clinical services. We've changed our trainings to really assist our counselors and nurses to be able to do concurrent documentation in a home, which presents its own unique struggles, but that really assists our staff in being able to provide as many services in the home and all of the assessments that are necessary within the home and doing so with our client. Clients get referred to the mobile mental health program in a multiple of fashions. One of them would be internal referrals, and that seems to be a big significant amount of times on how clients are referred. There will be a known lapse in treatment that's coming up, such as a client is having surgery and they're not going to be able to get into the clinic. Or a client starts divulging information about how difficult it's really been for them to get to the clinic, or how hard it is for them to use public transportation or be in our waiting rooms. So staff will identify someone that they feel really could use services in the home. They'll present that information to the client either face-to-face at their recent appointment, or oftentimes a client will miss their first appointment, and so those counselors have connected with the client on the phone to tell them that there's ways to still obtain treatment from Best South, and it doesn't require always having to come to the clinic. Once that occurs, the counselor will reach out to the mobile team and will assess if this is an appropriate care of treatment for them. My mobile team staff will contact the client, explain the program, and make sure that they're comfortable in receiving services in their home. Once that occurs, we set up an appointment, we show up at the home, and we really outline how, other than the location of services, they shouldn't see any other change in the way they've received treatment from our clinics versus how they're receiving those services at their home. In our mobile mental health program, we have a lot of goals that we're working on with our folks and just as a program in and of itself. One of those goals is to help clients re-engage in more traditional services so they're getting back out into the community and being able to function. How we do that is we'll go alongside clients and assess their willingness, readiness to be at the clinic. We'll attend a first-time appointment again when they're re-engaging with traditional services. Another goal is to really reduce those hospitalization rates. So when a client is having a hard time stabilizing in their home, we're pulling in health home services into that treatment. We're talking with other community providers that offer home services such as the VNA. Lastly, some of the goals of mobile mental health services is really just to help the client stabilize. And that can look like a wide array of ways. Housing stability, strong connections with their primary care, and for them to have an understanding of the connections between primary care and mental health services and how those are really an integrated treatment. If you're physically feeling better, oftentimes your mental health symptoms improve as well. For our clients, there's no preset amount or length of stay in our program. We really take it on an individual basis. But very oftentimes, we're seeing folks up to about a year's worth of time. It seems to be a very common length of stay, where the goal is then to link them to the right level of care. That may include our PROS programs, personalized recovery-oriented services, our traditional clinic services, or sometimes it's very evident they need that higher level of care and they're going to our ACT programs, which is assertive community treatment. The main importance of the mobile mental health services program is that when clients are going to have a lapse in care due to a barrier, we want to break those walls down. We want to be able to go where they are and help them not have instability. Feel free to reach out to me at any point if you have questions about how we started mobile mental health services, our envisionment of getting this program off the ground, or the importance of CCBHC services so that this program can continue in a sustainable model.